Antibiotic class. Mnemonic is antibiotics can terminate protein synthesis for microbial cells like germs. Aminoglycosides, cephalosporins, tetracyclines, penicillins, sulfonamides, fluoroquinolones, macrolides, carbapenems, lincosamides, and glycopeptide. So here we will discuss mechanism of actions, coverage, uses, side effects. So first is aminoglycosides. Aminoglycosides drugs streptomycin and gentamicin. Its coverage is gram negative and the mechanism of action is inhibit protein synthesis 30S and its uses bacteremia and abdominal infections. Next, side effects nephrotoxics and ototoxics and don't give to myasthenia gravis patients. Next is cephalosporins. Actually, these are 5 generations. First generation is cefazolin and cefadroxil and cephalexin, and second generation is cefaclor and cefoxitin and cefotitan. Only these cover anaerobes in cephalosporins. Next is third generation ceftazidime and ceftriaxone. Ceftriaxones avoid a neonate because of impaired biliary metabolism, and cefotaxime used for neonates instead of ceftriaxone. And next is fourth generation is cefepime, and the fifth generation is ceftaroline, and its coverage is gram positive and gram negative. And this mechanism of action is inhibit the cell wall synthesis and its uses skin, urinary, respiratory infections. The side effect is cross sensitivity and colitis. And next is tetracyclines. Examples are doxycyclines and minocycline. Its coverage is gram positive and gram negative. And mechanism of action is inhibit protein synthesis 30S. Its uses Lyme disease, throat bite of tick, spread to joints, heart and nervous system, and pelvic inflammatory disease like syphilis and chlamydia. And it's not for safe, these are safe for the children's. Next side effect is photosensitivity and penicillins. Penicillins examples are the ampicillin and amoxicillins. Its coverage gram positive and negative, and mechanism of action is inhibit cell wall synthesis. Uses ear, nose and throat and skin, urinary infections. Side effects hypersensitivity and gastrointestinal effect and candidiasis. Next is sulfonamides. Examples are sulfasalazine and sulfamethoxazole, and coverage is gram positive and negative. Mechanism of action is inhibit folate synthesis. Next, uses UTIs, burns and eye infections. Side effects are the photosensitivity and gastrointestinal effect. Fluoroquinolones examples are ciprofloxacin and levofloxacin. Its coverage is gram positive and negative. Mechanism of action is inhibit DNA replication. Its uses are respiratory, urinary infections. Side effect is gastrointestinal effects, CNS like insomnia and dizziness and height. Then the macrolides are, for examples, azithromycins, erythromycins and clarithromycins. Coverage is gram positive. And mechanism of action is inhibit protein synthesis 50S, and uses are pneumonia, ear, nose and throat and sexually transmitted infections. Side effect is the gastrointestinal effect, and carbapenems examples are meropenem and ertapenem. Coverage gram positive and negative, inhibit cell wall synthesis, and uses is urinary and abdominal infections, skin and diarrhea. These are the side effects of the carbapenems. And the lincosamides examples is clindamycins. Coverage is gram positive and mechanism of action is inhibit protein synthesis 50S, and uses skin, bone, lung infections. Side effect is diarrhea, nausea, vomiting. And glycopeptides example is vancomycin. Coverage gram positive and mechanism of action is inhibit cell wall synthesis. Uses skin and endocarditis. Side effects red man syndrome, rash. Thank you for attention.